Chiropractic Biophysics, a possible physiotherapy for scoliosis. Being diagnosed with scoliosis means that you have a structural spinal condition that has developed, and scoliosis involves the developing an unnatural sideways spinal curvature that also rotates into the concavity. We also know scoliosis is unfortunately a progressive condition. It is in its very nature to worsen over time, and particularly during growth in adolescence, and it can also worsen in later stage life. A patient's Cobb angle measurement needs to be diagnosed with a Cobb angle of 10 degrees or greater with rotation, and a Cobb angle, it typically is measured on a scoliosis x-ray. Now, we know scoliosis introduces a lot of uneven forces to the spine and to their surrounding tissues and body, and also the nerve system around it, and we also know it can become increasingly misaligned over time. A patient's Cobb angle is determined during an x-ray, and the measurement is taken from the most tilted vertebra on top of the curve to the most tilted vertebra on the bottom of the curve, and the Cobb angle is typically expressed in degrees. The larger the Cobb angle, the higher the number, like meaning a 40-degree scoliosis is more severe than a 20 degrees, and the greater the scoliosis means the more severe the scoliosis is out of alignment. It also means the more severe the scoliosis is in its presentation, which also means the more severe the effects would be. Now, when we look at scoliosis, a lot of patients that have scoliosis, they will seek non-surgical treatment. And when they seek non-surgical treatment, they very often can seek massage therapists or chiropractors or physiotherapies. And very often they'll go see chiropractors and they wonder if a chiropractor can improve their scoliosis. And we look at scoliosis and we know chiropractors can treat patients with scoliosis for the symptoms involved with scoliosis, meaning if they're having back pain or discomfort or tightness. But they have to be very specific, or a scoliosis specific chiropractor, if they want to treat the person's scoliosis, not just symptoms. So general chiropractic care is beneficial for scoliosis patients, but if you want to reduce the size of scoliosis, you need specific scoliosis care that may be provided by a chiropractor, but normally it's very scoliosis specific. And when we look at scoliosis specific chiropractors, how do they improve scoliosis? Well, a scoliosis specific chiropractor knows exactly what's happening with the scoliosis and what actually affects the scoliosis and how we integrate different treatment options or different treatment programs to try to reduce the curve at a different structural level. There's never treatment guarantees when it comes to reducing a scoliosis, but we do know the more proactive a treatment plan is, and the more we integrate the treatment with other condition-specific treatment options to help reduce the curve, the more likely the curve is to reduce. And normally, as we treat the scoliosis, we want to reduce the curve and stabilize it and perform other treatments to try to reduce it again. Now, a lot of patients that seek out chiropractors, they may seek out a type of chiropractic care called chiropractic biophysics. And when it comes down to breaking down this word, we know chiropractic refers to the branch of healthcare that focuses on misalignments of the joints of the spine and how it can possibly affect the nerve system. And we know biophysics is the scientific concept of applying any laws of physics to biological systems. So chiropractic biophysics is the chiropractic practice of applying scientific principles to the diagnosis of the spine and the attempt to facilitate long-term pain relief through positive structural changes. And it's that structural approach that's very important when we look at the improvement of scoliosis. So when we look at CBP, how would it approach scoliosis treatment? Well, CBP, first of all, doesn't undervalue posture, but it focuses more on the effect of posture and other spinal issues and spinal curves and alignment. So it looks at alignment and structure. Chiropractic biophysics also focuses on how to produce changes that address those issues on a structural level, not just a symptomatic level. We know chiropractic biophysics uses different types of therapies, like physiotherapies, like traction, exercises, stretching, and also chiropractic adjustments to help manage and reduce the structural components that are involved in scoliosis. So the big thing is that chiropractic biophysics focuses on a structural approach to spinal alignment, which is something that a scoliosis-specific chiropractor should be doing. So chiropractic biophysics tends to be one component component that we use to help manage and reduce scoliosis cases with other components and other therapies that we add to the Chiropractic Biophysics program. So we know scoliosis is a progressive condition, and being proactive with treatment is by far the key to success. As a structural spinal condition, we know we have to treat scoliosis structurally, not just symptomatically. And we know patients with scoliosis can benefit from general chiropractic care to help improve with their symptoms. But if they want to impact scoliosis on a structural level, they must impact scoliosis in the most structural component. And this is where the underlying principles of chiropractic biophysics may be beneficial. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.